everyone. Welcome to the Caring View Show. As you can clearly see, I am not Mark and I am not Adam. They have very kindly left their show in my capable hands. My name is Beth Britton. I'm a former carer to my dad, who had vascular dementia for 19 years. In the work I do now, I do campaigning, consultancy, and lots of writing work. And I'm very fortunate to work with many experts by experience, some of whom are my guests today for our takeover show entitled Working with Experts by Experience in Dementia Care and Support. What we're aiming to do on this lunchtime show is give you an insight into not only living with dementia, but why you should be working with people with lived experience, whether that's through shaping your services, whether that's through employing your staff, or whether that's through training your workforce. I'm very lucky today to be joined by Chris Maddox, Masood Qureshi, otherwise known as Mac, and Rosie, who is being supported today by Meg. So without further ado, I am going to let my guests introduce themselves, and I'm going to begin with Rosie. Hello, Rosie. Do you want to tell everyone a little bit about you?
Okay.
So a little bit about you.
Okay. Hello, everybody.
Is it better if you see yourself? There we go.
So, good afternoon. How are you?
Good, thank you, Rosie. Hello.
And what do you do?
So basically, where we work now is over at No Hill. There's a best practice team. In saying that, we also have Megan the Key, because I'm very unfortunate. I can't be able to be a part of doing this at the moment.
No, so you've got me instead.
I don't mind that.
So Rosie works on, we're from McIntyre. We're a charity that supports children, young people and adults with learning disabilities and autistic people. And we sit within McIntyre's best practice team. And our job is we focus on health and well-being of people, don't we? Yeah, that's a little bit about us.
And Rosie is living with dementia, and she speaks about her experiences of living with dementia and helps us all to understand more about what it's like to live with dementia and a learning disability. Thank you so much, Rosie and Meg. If I could go to Chris next. Chris, would you like to introduce yourself?
Yeah, good afternoon, everybody. Pleasure to be here with you today. Thank you for having me. My name is Chris Maddox, and I was diagnosed with early onset vascular dementia when I was 60 years old. Since then, I've been diagnosed with Parkinson's disease, and now I have Lewy body dementia. And Lewy body dementia is supposed to be the second most common form of dementia, but the least diagnosed and the least recognized by people. So Lewy body dementia does link in a lot with Parkinson's disease. So I'm an ambassador for the Alzheimer's Society, and I'm currently the first person living with dementia on the board of trustees for the Alzheimer's Society. So it's about time they had people with lived experience on the board of trustees for the Alzheimer's Society, and I'm the first one. So I'd love to share and talk about my experiences, but I've got a lot to say, so I best be quick now. Thanks, Beth.
Thank you, Chris. Mac, would you like to introduce yourself?
Yes, thank you. Can you hear me all right?
I can hear you.
Yeah, I'm in the car. I'm actually, there is a funeral a bit later on. I'm in Burton-on-Trent. And up till about 3 o'clock, I was free and I thought I will join. It's a pleasure to be here. And it's nice to see my colleague, Chris. We've known each other quite some time, and of course yourself. I was diagnosed with dementia in 2010, and I'm living quite well with it, really, really well. better than before diagnosis. I'm busier now than ever. And of course, we work with that, and it's nice to be here. Thank you very much for having us.
Thank you, Mac. So for our viewers today, so I've worked with Rosie and Meg for many years. I've worked with McIntyre since 2013. Rosie is employed by McIntyre, and she supported us on the Department of Health and Social Care funded dementia project. And she's quite a regular speaker at Congress as well. She spoke at Dementia Congress last year and going this year. And I know Chris and Mac, apart from social media and all the amazing things they do and the awards they win, they both work with me training NHS staff in tier two dementia course that I train as an associate trainer. They are my experts by experience, and we also do some work together. Mac and I have done some work together on some radiographers training as well. So it's a pleasure to have you all with me. Now, I know that you will have done other work as experts by experience. I don't know if anybody wants to talk about anything you've done aside from what you've done with me and the impact that it might have had that you've been told. Any learning or public speaking?
Yeah, I have done a bit of both and went a step further. We co-wrote a book which has just been published, challenging assumptions around dementia. And I think that's had a real good impact. We've had over 2,000 people that have actually read it online before it was available on the market. But yeah, it's been busy. It's been exciting. It's been a learning curve for us and also people that were involved, and it's been enjoyable. And the thing that motivated me is that, you know, whatever we say, we might not benefit from it, but our contributions are going to be there, and maybe our grandchildren benefit from it, because we are actually going through a condition, and you can't really read that in a textbook. You know, you've got to feel it, you've got to live it, and I think it's important that people hear us. Thanks.
Absolutely, totally agree, Mac. Rosie or Chris, is there anything you'd like to add to that? Or Meg, maybe?
Regarding experiences that we've had.
Yeah, the impact that it has, Meg. I mean, you see this in McIntyre all the time.
Absolutely. So we're very much throughout our DNA at McIntyre. We believe in having experts by experience involved from the very beginning of anything. When we're making policies, when we're changing anything,
Definitely.
the whole DNA was co-produced, wasn't it?
Yeah.
With everyone's voices being heard. And just for me and what I noticed is, for example, Congress last year, just the reaction that we get when we co-present with it, and the admiration that people have for you sharing your story, and the impact that hearing it direct from you, Rosie, has on people, doesn't it?
Yeah.
Chris, what about your experiences? I know you've done loads of speaking. What kind of impact do you think that has?
Yeah, I have given talks nationally and internationally, and it's all about raising awareness for me. And if I can help somebody to not have to go through some of the awful things that I experienced, that's what matters to me. And it's so important that everybody sees the person and doesn't see the dementia or doesn't see the color of your skin, that they see you as a person. And that's very much overlooked, I think, when you're living with dementia. And I'm also involved with something called Time for Dementia, which was initiated by Sussex and Brighton University, and it's training for all medical health posts, from doctors to nurses to physios, and they do a training course over a 2-year period, and they actually come into our homes and talk to the person living with dementia and the caregiver, and they can learn things from textbooks, but they say they learn far more from experts by experience. and by talking to us. And I've been in medical situations where as soon as they know you have dementia, they talk to your carer or your partner and not actually talk to you. And it's so important to talk to the person. We can still understand. So if you're talking about me, please talk to me.
Really great advice. Mac, what can professionals learn from people living with health conditions and their family members? What do you think is the main learning?
I think that it's something that Chris has just hit. It's actually looking and listening. Listen to the person that you're talking to and the person that's got the condition. Family carers within the South Asian community, for instance, traditionally,
Oh, Mac, your audio's gone a bit funny on me.
Can you hear me?
I can hear you now. You were saying within the South Asian community, and then I lost you.
Oh, right. Yeah, within the Asian community, what happens is that they traditionally look after their elders, but they're not trained to do that. There are some needs that a person has that they don't seem to understand or that don't seem to have, and therefore that basic training is needed. And therefore, I think that little bit of initial training, and the professionals, what they need to understand is that they need to change their perception. Like Chris was saying, talk to us. Don't talk to us through somebody else. Talk to us. Because somebody with a condition, communication is not just verbal. It's sign languages, it's nodding of the head, it's gestures, and it's sort of gestures. So all that is part of communication. And I think what they need to understand is that they need this eye contact with us. They need to talk to us because there are times we might even lip read, So if somebody's got a hearing problem, that will come into it. So all these things professionals, I think, need to look at.
Thank you. Now, I've worked with all of you all. Meg.
I just wanted to echo that, because obviously working in the sector that we work in, where we've people with learning disabilities and autistic people, we different communication methods are used quite a lot. And it's interesting, I found out the other day that actually in communication only 7% is words, 55% is body language, and now I apologise for my maths, but the last of it is voice and tone of voice. So it's really interesting to hear Mac and Chris share that, because we see that a lot.
Yeah.
And another expert by experience that I work with always says, listen to me with your ears and with your eyes. And I just think that's powerful.
Yeah, that's really, really good advice. Now I've worked with all of you. We've lost Mac temporarily. Hopefully she's got some connection. He's going to come back. But I was going to share some quotes from some of the work I've done with you guys.
Can I just add one more thing, Beth?
Absolutely, Chris, yeah.
I just wanted to say that dementia is not all about memory, because everybody thinks that having dementia is all about memory, but it's not. It can affect your sensory issues and I've forgotten the word for it now. Perception and sensory issues. So it's not all about memory. I have a problem with a lot of background noise. If there's a lot of noise going on around me, my attention would be drawn to the noise and not so the conversation that we're having today. So dementia isn't all about memory. That's all I wanted to add.
Yeah, that's a really important message, and it doesn't get out there enough. I think a lot of people, when they start to develop dementia, it's often not really about memory that's the problem. It's about trying to do things in the day-to-day. Those tasks like making a cup of tea, for example, can just suddenly become really tricky. There's Chris's cat, the star of the show.
I'm sorry.
That's okay. So I was going to share some quotes that we've received from work that we've done with other professionals, where we've worked with experts by experience. So as I said earlier, I work with Chris and Mac delivering training for NHS professionals. And I've got some great quotes. So from my training with Chris, it was good to hear the patient's perspective and gain an understanding of how dementia affects their daily life, particularly when dealing with the health service. It helped me think more about how to interact with those living with dementia. Another quote, this was very powerful. The lady was articulate and honest and really helps professionals think about the person. And then I love this quote. It was very helpful to have someone who actually lives with dementia explain her journey and current symptoms. Personal insights always have more impact and are easier to remember than just a list of symptoms people may experience. So I've embarrassed you, Chris. No, I was going to do the same to Mac, but he's not here. He's left us. Hopefully he's going to come back. But some of the quotes from my training with Mac, it's always the very best form of learning to really understand something, to hear it through the point of view directly of someone in that situation. This is invaluable insight and learning into understanding what is wrong, how they perceive things, and solutions that they have found useful. And then another one, he was very inspirational and informative. His experience gave a whole new insight, and I've taken away something very interesting that he said, which I will continue to share. So to know that you've had impact that lasts beyond the training room is so important. And I think that is what working with experts by experience delivers. You guys deliver that shot of reality that someone like me, with all my facts and everything I can train, it's just not the same when you're not alongside giving that real life experience. Now I know that at McIntyre we've worked with people in our dementia special interest group, haven't we, Meg, who are living with dementia?
Yeah.
And we've found staff find that really useful. Why do you think staff have found that so useful?
I believe that it's because nothing is more powerful than hearing direct from the person that, it's affecting themselves, and it's as well hearing that having that honest conversation as well, and just staff just seem to, it's just so much more impactful for staff to see that, and our dementia special interest groups wouldn't be really worth their time if it wasn't hearing from people themselves. We've had some fabulous people join us. Do you remember anyone that joined at the DSIG?
Oh dear.
Who do you remember?
Oh, correct. I think.
Because you used to be part of them as well, didn't you?
Yeah.
Yeah. Do you remember Wendy coming and joining us back in the days?
What's his surname?
Mitchell.
Of course, I remember it.
Yeah.
Wendy Mitchell's a great name to bring up because I've got a fabulous quote. She joined me only last week for some work I was doing with a care home. And I had feedback from staff. A fabulous meeting. Thank you so much, Wendy. What insight. Thank you from the bottom of my heart for your bravery. And I literally noticed during that training session, it was like a light bulb moments. And after Wendy had left us, we did one of these interactive online sticky boards called Jamboard, a Google Jamboard. And it was literally populated by staff, all of whom had loads of ideas of things they'd learned from Wendy, what they were going to take from her talk to them, what they were going to go and try and implement with the people they support. You can't ask for more than that. That just makes such a massive difference. It's really, really helpful.
I think sometimes we can be the voice of other people as well, Rosie and myself, because I know a lot of people living with dementia who couldn't do what Rosie and I and Mac are doing today and be interviewed. So, I share experiences that other people have shared with me. So it's not just all about me. But sometimes our voice can be heard when they're not able to use their voice. So I think that's really powerful, Rosie, that, we can talk on behalf of other people as well.
And I think you've raised a really interesting point, Chris, because I was going to say, why should care providers work with experts by experience? Now, they will be supporting many people who don't have a voice now or have very limited voice.
Mm-hmm.
What do you bring to the table to help them understand more?
The facts, because one of the things that very often people living with dementia are described as being aggressive. And I always say that there's an emotion behind that behavior, and I don't like to call it aggression. I think it's frustration a lot of the time because the person may not be able to communicate. They may want to go to the bathroom, they may be in pain, they may just want a hug. So get down to their level and speak to them on their level, and then just give them, hold their hand or something like that. So it could just be an emotion, that an unmet need in that person. And I find sometimes that I used to be the most placid, laid back person, but I get frustrated sometimes at the things I can no longer do. And I used to be very good at multitasking, but I can't multitask anymore. I have to do one thing, finish that before you ask me to do a second thing. If you ask me to do 3 things, I probably wouldn't do any of them.
Rosie, do you find it easier if it's one thing at a time? Does that make things easier?
Yeah. And it's interesting because you always say a quote, and you said it at Congress last year as well.
Tell me what it was.
You spoke about, you said it's important to remain positive, and you said you should focus on what you can do, not what you can't do.
Okay.
Don't you? You're a big believer in that.
Yeah.
That's really important advice. So if you're a care provider, if you're running a care home or a home care organisation or something like that, I thought to myself, what is the real takeaway for you? Why should you work with the people you support? Why should you bring them in on interview panels? Why should you speak to people who don't draw on your support? So you might bring in a Chris or a Mac or a Rosie or one of the many other experts. There are many organisations who you could contact if you wanted to have experts who are very used to speaking in sort of meetings and in staff training. You could go to Innovations in Dementia, who have provided some fantastic guidance on involving people who are living with dementia. You could also use the resource of the Three Nations Dementia Working Group, who I know you're part of, Chris. Now, you guys do some amazing webinars, don't you? And your members do speak, in training sessions and other sort of meetings and things as well, don't you?
Yeah, the webinars we do, they're prepared and they're run by people living with dementia. So we do the whole thing ourselves. And sometimes we'll have guest speakers. But yeah, we talk about everyday things living with dementia. Maybe driving or not being able to get out anymore, or any topic that there's need for discussion, we'll discuss. So it's a big learning curve. And initially we started doing the webinars during COVID and lockdown when we couldn't go out, thinking that it would be mainly for people living with dementia. But we're finding now more and more that it's caregivers and professionals that are watching our webinars more than people living with dementia, because they're using it as part of their learning tool and picking up so much. And I can remember this medical student that I had at the house, and he said, I can learn everything from the books about dementia. I can write a prescription, but I don't know the practicalities of living with dementia. And, and sometimes, you go through that situation where, excuse me, where somebody says to you, I've told you that. And you say, no, I have. No, you haven't. Yes, I have. Well, I now say, I'm sorry if you have told me that. I can't remember what you said. So it takes that tension out of a discussion. So it's just lots of little tips, really. And it's visual perceptions. That's another thing that people living with dementia get. I can remember Wendy Mitchell telling me that she couldn't see any light switches in the rooms in her house because the walls were white and the light switches were white. So she just put coloured tape around the light switches. So straight away when she walks into a room, she can see the light switch. There's just lots of little practical tips that we can give. And one of the most important things for me is I tell people not to talk too quickly. Because if somebody talks quickly at me, it just sounds like gobbledygook in my head. And my brain is still processing things, but much slower than it was before. So I need people to speak more slowly.
Thank you, Chris. Welcome back, Mac. You missed me reading out some quotes from some evaluations and training we've done together.
I got disconnected. The phone overheated for some reason, and I had to log back in.
We've had a few technical gremlins today. We were just talking about what we think care providers gain from working with experts by experience. So thinking about care homes, home care organisations, what would they get from working with someone like you or Chris or Rosie or the other advocates who are living with dementia?
I think what's important is, like Chris was just saying, communication is one thing that needs to be looked at, and they have to accommodate, and then I have got an added disadvantage, if you like. I'm bilingual, and when you're bilingual, you think in a different language. And when you think in a different language and you translate it back into the language that you're using at that time, it takes that little bit of time. And that time lapse is sometimes misunderstood, even by the professionals. So that's something else that they need to look at. And, every person is unique. The issues are unique, and their reactions or tips or coping mechanism is different. So, they need to sort of know their customer, as you were, know the person before they can diagnose or even be part of a research. Because for a research, you're learning. Either you're finding a cure for the condition, you're gaining more knowledge, and even maybe prevention in the future. So they need to accommodate people with dementia and talk slowly, face-to-face contact, eye-to-eye contact, look at them, and of course nodding and gestures are important, so that we know. And the biggest thing that we have to overcome is the trust. That person living with a condition needs a safe place, and that is what the professionals sometimes overlook, because they might be looking at the computer screen, typing away, and not looking at the person. So consequently, that barrier comes up, and there's a problem. Other than that, it's fine. Perception needs to change. To give you an example, I had my cataracts done not long ago. And you've got to go through the questions, are you diabetic, and have you got any other ailments, what medication you're taking, this, that, and the other. And then, 10 minutes later, I said, I've got diagnosis of dementia. And as soon as I said that, the pen went down, and she started talking. Can you understand me? Do you know what I'm saying? Do you know what you're here for?
Oh, no.
And that is so degrading. It's unbelievable. I'm not at that stage where I'd get annoyed, but the thing is, it's not healthy, to say the least. So that needs to be.
We've got a lot of work to do to challenge the stigma, haven't we?
Yes.
Chris?
And I think it needs to be.
I think one good question is, why don't people say to me, how does your dementia affect you? Because it's always said you meet one person living with dementia and you just met one person living with dementia. We all have different symptoms, we're all affected in different ways. And I can remember getting involved in some research. And it's very important that you're involved from the beginning. And it's the same with the training that you do, Beth.
Right.
And it was a case of she went around every one of us taking part to say, well, how does your dementia affect you? For example, one of the people on the group can't read what's in the chat box if the chat comes up, and another person said if they think of something, they need to say it straight away, otherwise they forget it. So do your homework and find out how the dementia affects each individual, and just make a little note of that. And that's really helpful and really useful for us and for the people whether they're in care homes or whatever, so that they know how to talk to us. And just one quick example I was going to give about a gentleman who was in a care home, and tea and coffee came around, and a colleague of mine was there, and the gentleman wouldn't take tea or coffee. And my colleague spoke to him and said, "Well, why aren't you having anything?" He said, "Because I haven't got any money to pay for it." So the solution was just to give him a wallet with some coins in it. And he started eating and drinking because then he thought he was paying his way. That's something very basic, very simple. But when you think about it, we all carry money around with us, don't we? Oh, credit cards all the time. So why not apply that to people who are maybe in care homes?
And I think when you bring in experts by experience, for example, into training sessions, and you give you guys the chance to talk about your experiences, but then also open it up to everyone and say, actually, would you like to ask Chris something? And people will often ask about communication or how to support with personal care, things like that. And you guys just have an insight that we don't have into what living with dementia is like. And as you say, you meet many other people as well, and you hear insights. Now, Meg, in McIntyre, as with learning disability providers, you guys are involved in the Oliver McGowan training. The Oliver McGowan training, if Chris and Mac aren't aware, I'm sure Rosie knows, it mandates that you have trainers who are living with a learning disability or autism. What kind of impact do you think that's going to have in the sector?
Well, we've already started to deliver some of our Oliver McGowan training, and I have to say about the impact that it has on the co-trainer as well, the value that it brings people. People that are drawing on my support at McIntyre are so excited to actually get paid to share their thoughts, to share their experience. It's a whole new, and so they should be. And I just think, like we say at McIntyre, is nothing about me without me. So how can we deliver training without that person experience? And like you say, everyone's unique, everyone's different. And it's so important to hear from everyone, to hear all the different things. I hadn't even thought about, like Chris was saying about the gentleman, and he weren't drinking because he couldn't pay for it. And it's just you just get these real small, simple ideas that make the biggest impact.
And it's so because it comes from the person who's living that experience.
Yeah, because like you said, Beth, before, we can read the literature, we can read it, we can do the training, but I'm not living with dementia. I can advise and suggest what I've been taught and what I've learned, but ultimately the best person to learn from is people with lived experience.
Absolutely.
So is it important that people hear your thoughts? Rosie?
Definitely.
Yeah.
Definitely.
It's really important, isn't it?
Definitely.
Yeah.
Well,
considering the fact that I haven't got dementia myself, which I never knew I had until now, because I've not had it. Trying to get my head around it.
You do. And you share that with people, don't you?
I do, yes.
Rosie, do you think people are surprised that you can share things when you have dementia?
I haven't known to, yes.
And Chris, would you say the same? You think people might be surprised that you can even contribute?
People say, you don't look like you've got dementia. Well, what does dementia look like? But I think an important thing, and I don't know, Meg, whether you find this as well, is that when we're asked to give talks and when we're asked to share our experiences, it gives us that sense of purpose. It gives us a reason to get up out of bed in the morning. And, you know, in a 3-month period, I had my diagnosis and lost my job because of my dementia. So I had a choice. I could either sit at home, watch daytime television all day and vegetate, or I could do something with what was left of my life, and that's what I've chosen to do. and I want to do as much as I can for as long as I can and while I can. So it does give us a purpose, doesn't it, Meg, when we're doing things and giving talks?
Absolutely, and that you know, for your well-being, and also, you know, from World Alzheimer's Month, they've established the 12 risks as well, and one of them is, you know, staying active, staying sociable, keep doing what you can do. Don't worry and focus on what you can't do, and being creative and to do different ways. Like for you to having to just stop work is just and the value that you have in sharing your experience is amazing. And I know from some of the co-trainers, they're just so excited. They just feel so like they're a part of something as well, and they can't wait to get to work. And that's just such a powerful thing to see, and such a lovely thing to be involved in as well. That's what keeps me going.
Yeah, me too as well.
Absolutely.
So I know pretty much because even though I may have it, it's not something. Because when I first got told, I didn't know what to expect. It's not something that come to you instantly. It was a case of trying to get used to it.
But you are living proof that you know you can live well with dementia. You can work with dementia. You can be valued, isn't it?
We're still the same person. You know, the day we got diagnosed with dementia as we were the day before we got diagnosed. So again, it's about seeing the person and not seeing the dementia.
Meg, I think you picked up on a really interesting point for providers there, because I think our audience is predominantly care providers, and I think you've picked up on a really important point that actually by involving the people they support in their service design, in how they make policies, in their interview processes, in their staff training, they're also going to give the people they support purpose. Mac, do you find that being involved in training, being involved in initiatives that help to provide better support gives you purpose? It makes you feel like you're contributing something. Oh, I've lost him again. Oh, the tech. I'll take that. Chris, do you want to take that question if you were listening?
Yeah, definitely. You feel as though you're doing something useful, because when I had my dementia diagnosis, I felt hopeless and useless, and I had no hope. But now, by doing things that I do and the talks that I give and talking to people, I now feel hopeless and I feel useful instead of hopeless and useless. So it does give you a sense of purpose, and it does. I think I keep. People say to me, "Oh, you don't seem to be getting worse with your dementia," but I think I keep well, and probably Meg as well would say this, is because we're using our brains. So we're trying to keep as active as we can, which is very good for us because it helps us out, and it helps us to live better lives and to live as well as we can with dementia.
Absolutely.
Yeah.
Now, I've put together a bit of a list of what I would suggest care providers wanting to begin or develop work with experts by experience might want to do. So I'm going to read them out, and then you can all debate them, cross them off, add your own, see what you think. So I would say you should work with experts from the start of any project or initiative, not halfway through, not at the end as a checkbox exercise. It should be from the beginning. It should be meaningful. It shouldn't be tokenistic. It shouldn't be, we just want you guys to tick something off for us. It should be really meaningful contribution. I think it should be an equal partnership. I value every expert I work with more, frankly, than myself. I always make contact with people. I always ask for things that will make things easier for them. If I'm working with a third party organization, I think it should be about an equal partnership, and everyone, people in my position, etc., valuing what Chris, Mac, Rosie, and other people living with dementia bring to the table. I would say it's about working in ways that make sense to experts. So you will all have your own particular needs, I would imagine, when you're doing something. And we should appreciate that it will be different for everybody. And we should work in ways that make sense to each of you. We should be the ones adapting, not the other way around. I think you should pay experts for their time, where people are contributing to learning and development, interview panels, things that have value to the sector. So an expert should be paid. They should be paid as equally as I or anyone else in my position might be paid. And I think they should have as much involvement as they want, and to do it in a way that makes sense to them. So it might be that they want to be involved in the whole session of a training course, for example, or it might be something much smaller than that. Now, I can draw on experience I've had with a colleague at McIntyre and a lady that McIntyre supports, and myself. We have co-designed and co-delivered a loss and bereavement training for ARC England. And when I say co-designed, we did it with Jess, who lives with a learning disability and is employed by McIntyre, myself and Nicola Payne at McIntyre. We designed the training with Jess over many hours. We deliver the training over almost 4 hours a session with Jess. And she gets some amazing evaluations, because you just can't beat hearing from an individual who is living with a condition and has that experience. What resources would we all like to signpost to? I've talked about innovations in dementia. Mac, did you want to come in?
Yeah, you were talking about what involvement does and what people gain. I think that, like Chris was saying, we are all different. We're all unique. We're not rare. We're unique, and because of that, if you speak to me at 6 o'clock in the morning, and then ask the same question at 12 o'clock in the afternoon, and then that same question at 6 o'clock in the evening, you might get 3 different answers. And also, when it's nice and sunny, you'll get a different answer than when it's raining. And that isn't just with people with a condition. That happens with most people. And these are some of the things that need to be accommodated when somebody's talking to people with dementia. And they have to remember that our concentration level is not as good as it was. And there are times when we will either repeat ourselves or maybe ask to be repeated, if that makes sense. So these are the little things. And you were talking about the people learning from us. Yeah, we did quite a few sessions on that, and the feedback that I had was that they appreciated it, and the tips that I gave them, they've used, and which means that at least it's working for some people. And the good thing is that they're sitting there and listening to us. That has been the biggest problem, not listening to us.
Absolutely. And it's
I know all too well that people should be listening in the sense that everyone can get their views across, and so that they have a structure in mind that they can work on.
Absolutely.
I'm thinking of people who may have dementia.
Yeah.
I think I would add to that we do get tired very quickly, because our brain is processing things. It's hard work for our little brains when you have dementia. So give people regular breaks and screen breaks and things like that, because as I get tired, my concentration is not so good. So just give people regular breaks, and it's always nice to stop for a cup of tea or a cup of coffee or a cold drink, isn't it?
It is, absolutely. And I know that Mark and Adam often run this show in the evenings. And when I was arranging it with them, I said, no, it's going to need to be earlier. We'll do lunchtime, because I don't think you guys would feel good in the evening. To be fair, I don't think I would feel good doing this in the evenings after a long day of work. I think we're not far from wrapping up. I think what I wanted to get across was some sort of key messages for care providers. Why, again, that why and that how. For me, the why should care providers work with experts by experience would be because you'll deliver better outcomes for people with dementia and their families you support. You will increase satisfaction with your care service, because how could you not if you are hearing from the voice of lived experience? You're going to provide greater depth in learning and knowledge for your staff. We know that staff retention is so challenging in the sector now. If you can give people meaningful, engaging, interesting, exciting, because I sometimes hear some great little tips and advice, training for your staff, why wouldn't you? And it's going to get you closer to being an outstanding service, which obviously that CQC perspective is a consideration for care providers. In terms of the how, I think I talked earlier about engaging with innovations in dementia. I think Mark will share their link with you. They have produced a suite of documents around how you can involve people with dementia in an array of different ways within care services, within research, etc. The Three Nations Dementia Working Group have some fabulous speakers. Are there any other involvement groups we would like to signpost to? You've got Dementia Alliance International, Chris.
I think I would just want to add about language. Use of language is so important. And even today, in hospital settings, people are still calling us dementia sufferers or demented people. I would much rather be referred to as a person living with dementia. Words hurt and words matter. So please don't call us dementia sufferers. And I'm not saying we don't suffer, but we don't want that title of sufferers. I live as well as I can every day with my dementia. So just be careful about how you say things.
And there are dementia language guidelines. Dementia Australia produced some fabulous ones, the world leading example on language guidelines. There is also on the internet a fabulous webinar that Nikki and Rosie and myself did, where Rosie was really actively involved in sharing lots of tips and advice about how you would support a person with a learning disability and dementia. It's on the internet, Rosie. It's on the internet. So Mark will share that link. We did that back in the summer and you were amazing. And I also wrote a blog in support of this show in the run up to this show, so that there are some fabulous links in there explaining why we were doing the show, and some great links to how you can innovate in a human way, as I called it. I'm not a fan of too much tech. I think you can't beat the voice of lived experience, and that would be my sort of closing message. Anything you guys would like to add? That final message to care providers, why should they be working with you?
My feeling is, why not? Why wouldn't you? If working with people from the very beginning is going to get things right and the care and support right, then why not? And don't be afraid to do it. Just do it. Nothing ever is going to work out straight away. It's all a learning curve.
Yeah.
Just try it, learn from it, and keep growing from it, and keep doing it.
Okay.
Definitely.
That's what I'd say.
Thank you, Megan, Rosie. Chris?
Yeah, I would say don't fill in the gaps for us. Ask us. And don't make assumptions. So just speak to us and ask us questions, and you'll get the real answers. Not made up answers or assumptions because you put 2 and 2 together and make 5. Please put 2 and 2 together and make 4 by talking to us and including us and listening to us, because there's listening and hearing, isn't there? And you can listen without actually hearing. So I would say, would you please hear us as well as listen to us?
Thank you, Chris. Mac, your final message. Why should care providers work with people living with dementia?
I think you can't get that actual feeling, the inner feeling that one has from any textbook, and you need to talk to that person. You need to understand, read between the lines, and the biggest thing, we were talking about language, and that language works both ways. There is language that the professional used in front of us, the patient, as you were, and there is also a language that a professional whose first language isn't English to start off with, and when he's talking to us, people with dementia find that difficult. That needs to be looked at, because there are times I've had many people that have said that they went to see the consultant and they couldn't understand what he was saying or what she was saying. So that is also important. Don't look at our disabilities, look at our abilities. I always look at the abilities that I've retained. I don't look at my disabilities, you know. For instance, one professional gave me a piece of paper and a pen, and he said, write something on here. So I wrote the word something and gave it him back. And he didn't like it, but it was there. You know, that's
I'm throwing that for a training exercise, Mac.
and then I grabbed the paper again and wrote, what else would you like me to write? So these little things, they might not consider important, but to us they're important.
They are.
Good.
You have all been fabulous. Rosie, is there anything you want to add?
Right. Okay. And for words, I think what comes to mind is the fact that two people that I know of happens to work in my nephew and his girlfriend both work at some hospital in Nottingham. So they put people up before themselves. That's what needs to happen. So that they give me that diagnosis. To put them first, but for themselves, but also you have to have that trust in your patients.
Trust is so incredibly important. I'm going to finish with a quote. It's from the training that we've done with Jess, and I just think this is great. Fantastic to learn from someone with lived experience. Brought the themes alive by hearing from someone with expert by experience knowledge. Gave greater authenticity and integrity to the training. And another quote. This course was a great course, very relaxed and very informative. It was presented brilliantly, and Jess was an absolute star. You guys have all been stars for me today. Thank you so much for joining me on the Caring View show. Please give a round of applause for Chris, for Mac, and for Rosie and Meg.
Thank you.
Thank you, and bye-bye.
Thank you.
My apologies for